My name is Dr. Jonathan Inns, and I'm the director of the Medical Psychology Center. Before I get started, I want to introduce Emily Wing is an associate of mine. She's in the back. And together we are one of 9 clinicians at the Medical Psychology Center. And we are psychotherapists by training. And what I'm going to talk with you about today is stress management in these difficult times. And my training is particularly appropriate for this conversation. It's a little bit of a switch from the prior conversation because it's going to be a little bit more clinically focused, but hopefully that will make sense to you. And it really is a very human experience being stressed. So I'm going to try to make it both clinically relevant, but also tell you a story about what stress is about, because it's important, I think, following up what Linda was talking about, and I think even the discussion of transitions, that knowledge is power, really. Knowledge is so important in someone's perception of their world. And that's in large part a touchstone for the work in stress. That is, if you can understand what's happening to you, it becomes a great deal less problematic. Everyone has stress. Stress is a constancy in our world, but it's a question of how you manage it. So stress, by definition, is a physical, chemical, or emotional factor that causes bodily or mental tension and may be a factor in disease causation. So essentially, it can be something external, like the process of deciding where you're going to go in your next move, I guess, is one of the things you're thinking about here. And that can be a positive thing or a negative thing, depending on how you respond to it. One of the things that one of the famous psychologists is Akerson, talking about stages of development. And the final stage of development in terms of a dichotomy is either integrity or despair. And so the notion is, if you make decisions around your life that hold together in terms of the kind of person you've been throughout your life and the kind of decisions that you're making around the end of your life, then that has a certain integrity. If you're not making decisions about your life, if your medical care is fractured or fragmented, which I often see, and that's a serious problem. If your family is in some kind of disrepair, that's when you have despair. So this is why it's an important thing to figure out, that the integrity of a person, it's important whatever your stage of life. Just finished, unfortunately, working with a couple that I've been seeing for a long, long time, and they were wonderful parents to these 4 boys that they had, and did very nicely. The man that I was working with had been to Yale and then was a manager of the Groton School, and very sort of very strong in his way. Wife with him, they had a great deal of difficulty in terms of their relationship. So the work I had with them was to be able to bring them together in a way that their life maintained its integrity. She has just, within the last week, passed, but the 2 of them were able to communicate throughout their life in a way that was facilitated by treatment. And I took great honor in that, and that was really a very powerful experience for me. If they were not together, if they were fighting, and people, to be in a relationship is to have trouble. It requires a lot of work, as I'm sure you well know with marriage. So it's not something that comes easily, but it really makes a great difference in terms of how your life passes and how you perceive it and how it turns for you, both mentally and physically. So the term of stress comes from Hans Selye, who was, I believe, a Swedish physician, a pathologist actually, who defined the effects of stress using animals in an inverted U function. So what that means is basically imagine an upside down U, and that a certain amount of stress is important in life. A certain amount of stress is valuable to you. And it peaks at the top where you're engaged, the kind of thing that, I've forgotten the person who presented two people ago, but talking about transitions and the idea that your ability to manage those transitions, that's a good stress. After a period of time, the animal's going on in a prolonged stress, there begins to be decay of the body, organ difficulties, and then finally death over a prolonged period of time. So this is the idea that there's, and you can find these studies out, that there's research that demonstrates the effect of stress on the body. So that's why it's so important. So one of the things that I'm trying to portray to you is the notion of why we have stress. Sallie was working in the 50s. Stress is a function of our awareness, as Linda was pointing out. So you can see, I like to look at things in big picture and then also on the individual level, that our lifespan has gone within, from recorded history and actually prehistoric, all the way down in terms of this century. It's a tremendous jump. And why is that? That's because we have much better medical care. It's because we have better living conditions, better sanitation, better education, all of these things that you have participated in this century, so that you can imagine that with that kind of a jump in age, there are things that we're encountering that no one prior in the centuries before really had any awareness of. What it's like to live on into your 70s, 80s, 90s, that's really in the last century. I know as a 55-year-old father of two that I'm experiencing things that my parents didn't experience. Kids who have minds of their own and talk to you about what's going on in their heads, tell you things that they didn't, that I say to myself and I say to them, I never had this conversation with my father, and I'm not sure I'm better off for it. So, but it's a change that you have to get adjusted to. I mean, there were never situations like this. This Penguin Hall is a remarkable place. I asked whether they have receptions here because I'll try to think about it for my daughter's wedding when she's time. But it's.
Is it coming soon?
I hope not. She's only 15, so. But I think ahead. So the idea that that we're forced into decision-making processes that we had no awareness of prior is really the point of this. So this is an attempt at some humor, and what it's saying basically is that it doesn't help if you're running around feeling stressed all the time and rushing to a stress management course, right? And so the idea that your ability to manage your stress and your ability to absorb that and participate with that understanding in your day-to-day interactions, like Linda was saying, which she stole my thunder, was the idea of a nice relaxation exercise. But the notion that you are learning how to breathe, you're learning how to communicate, and sometimes in ways that you didn't have to before, in ways that you have to problem solve about your future. This is all part of the stress response. This one says wellness clinics, stress management checkups, hypertension screenings, lab tests, crisis after crisis, fiber foods, fish oil capsules, unsaturated spreads, plaque. Say what they may, McCormick, but we did it our way. Unfortunately, he's no longer with her, so I thought it was humorous in the sense that you got to make it work for yourself in a way that's, you really are participating in it. They did it their way, he didn't make it. So this is something that you're trying to make it work for yourself. So the notion of positive stress, different types of stress. I was trying to make the point here that you have what's understood as positive stress in terms of birth, graduation, love, marriage, success at work, retirement. Those can be in either one of these columns. So your negative stress, like what kind of negative stress do you have now in your lives? If I can ask for some audience participation. What kinds of things do you see as stressful? The stock market, financial well-being.
Time, not enough time.
Not enough time. Traffic, you're right. What other kinds of things? Health has to be one. I mean, that's one for everybody. College for your kids, or yeah, yep, yeah. Obama. He's stressing you out. Yes. He's trying to do all that redistribution, right? That's the problem with that one. So.
How about children?
Children is a stressor, yeah. So how are children and stressors?
They always want.
Give me. No, I mean, that's the thing, it's an interesting process, because I myself, it's one of these things that I'm sure you can speak better than I, that things that you didn't expect to encounter, you're having to understand. Either, I have a brother that's, my father died of Huntington's, and my brother is now dying of it, and I, would never have anticipated premature deaths, and I'm sure, I mean, no family is without its tragedies. And, these are things that are stressful, but you have to learn how to cope with them. So that's one of the things that we do. And, the notion of psychology, if there's anything that it has offered, is learning about how to observe an event and to make it different for yourself, so that we have, and I'll get to that, various skills that we bring to these things, whether it be stress management, relaxation training, as Linda did, as a visual, she was doing a mindfulness exercise, but there's really also stress management, I keep saying stress management, but relaxation training with your guided visual imagery, right? I'm sure you did that with your pain management techniques, right? Biofeedback is another thing that I did my master's and dissertation on. So there, it's a Western, sort of East meets West. It's the notion of using technology and a computer that gives you information about your physiology and monitoring that so you can make a change. So if you have things like headaches or pain management or headaches is another big use of biofeedback. These are all things that that psychology can offer to you. Also things like hypnosis. So in terms of focused relaxation, or if you're wishing to stop a certain habit that you participate in, or you're in pain. All of those things are useful as far as what psychology can offer. So along with, I'll just move quickly through these, along with increased life expectancy comes increased stress, common effects of stress on your body, headaches, muscle tension or pain, chest pain, fatigue, change in sex drive, stomach upset, sleep problems. And all of these things, what Linda was talking about, there are centers of our brain that are arousal based. It's the medulla of your body, the hindbrain here, that if you're more aroused in this sympathetic way that she described, that you're in stress, like if Obama gets elected again, boy, that's going to be trouble. So the notion is that there's going to be an arousal or an alarm set off in your head. And those kind of things are going to decrease. They're going to increase your stress. They're going to decrease your immune system response. They're going to make your sleep more disrupted. All these negative outcomes. So that's the thing about stress management I'm trying to say, is that your ability to be paying attention. The effect on your behavior, overeating or undereating, angry outbursts, drug or alcohol abuse, tobacco use, social withdrawal, on your mood, the anxiety, restlessness, lack of motivation or focus, irritability or anger, sadness or depression, stress management techniques, relaxation training, biofeedback, hypnosis. Another one is cognitive behavioral therapy, where you're changing your cognitions in the effort of changing your behavior. And so these are all things that, and I think you're a transition generation where we didn't talk about those things, or you didn't talk about those things. I think we're starting to get more comfortable with it. I'm a big one for personal responsibility. So it's not just like blah, 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 telling about yourself. It's about taking information and creating knowledge for the purpose of informing yourself for your betterment. And that's a good thing. You can't go wrong with that. So I thank you for your attention. And